Hey, welcome to the Gravity Doctors. I'm Dr. Brennan Spiegel. I'm a professor of medicine and public health, and I'm a gastroenterologist and the author of the book Pull: How Gravity Shapes Your Body, Steadies the Mind, and Guides Our Health.
And I'm Dr. Lachlan Kent. I'm a psychology PhD, and I research the idea of mental gravity, which is the connection between physics and the mind, and in particular, mental health.
And between the two of us, we're the Gravity Doctors. So Dr. Kent here, interested in mental gravity, how this force of the planet itself, this fundamental force of physics, affects your mind. And I'm interested in how it affects the body. And between the two of us, we're interested in both the mind and the body and how our relationship to Earth, our very home, which pulls us down, how do we stay aligned with it? And what can go wrong if we misalign with gravity itself?
And that brings us to today's topic, because we're really looking at the blend between mind and body and this idea of gut feelings, that sort of intuition you have that something is kind of off, it's kind of out of kilter. We're not in perfect alignment, but it's not a clear sensation. It's visceral. It's something that's, it's in that liminal space between mind and body. And it's what brought us together. So in your mind, you're the gastroenterologist. Brennan, what is a gut feeling?
People talk about a gut feeling, not in relation to gravity at all. They just think, something's the matter. I kind of sense almost subliminally, use the word liminally, that something's a little bit off. I think what we're going to talk about today is make the case that what might be off is literally your alignment with the earth itself. And so gut feelings, though, in the everyday language is more about just having this sense in my belly that there might even be a threat somewhere,
Yep. I don't feel I'm living in a world that's predictable and easy and, I don't feel made for it in some way. Something feels kind of off. And what's a good example of a gut feeling, you think? What's the prototype for it in terms of gravity?
Well, in terms of gravity, let me hold on to that for 1 second, because we'll get to that. More commonly, I see it in patients, let's say with irritable bowel syndrome.
Right.
This is IBS. This is the most common condition, gastrointestinal condition in the world, really. And many of these patients who have IBS will have stomach complaints. They'll have butterflies. They'll feel some tingling. They'll feel some really uncomfortable feelings in their belly. And it turns out, though, from the gravity side, that it's the same feeling you get when you're falling on a roller coaster. And interestingly, the same feeling people get when they're falling in love, for example. So these gut feelings show up in lots of different situations that have this sense, either physically or sort of metaphorically, of falling.
So when you're falling, that can be a pleasant experience. So you go on a roller coaster and you're having a fantastic time. It's exhilarating. You feel like you're cheating death. When you're falling in love, it's also exhilarating. You're not so much cheating death, but I suppose there's a risk of getting hurt. Is that the connection between the sort of positive physical fall and the positive sort of mental, emotional fall?
Yeah, well, let's take a step back and then we'll unpack both of those, because our goal in life is to stand up and stay up, right?
Yeah.
As long as we can, and as well as we can, until inevitably the earth draws us back. Now, we may rise spiritually, metaphysically,
At death,
but the body is pulled back, and we end up poignantly in a grave, which in some traditions, a grave is like a gravity box, right? It is a word that shares the same etymology as the word gravity.
From gravis, Latin, weighty,
Gravis.
heavy. Yep.
Weighty, grave, serious.
Gravitas.
So we are designed to stand up and stay up, physically and mentally. And we don't want to fall. We don't want to fall down. So it kind of stands to reason that if we're falling from, let's say, 15 or 20 stories on a roller coaster, which we were never designed to do, right? That's our body's telling us, you're about to die, right? It's as if the gut has a G-force accelerometer in it that's detecting movements that are worrisome, right?
Yeah.
And it's shouting at us to stop.
And not just death, but sort of loss. I mean, when you fall as a child, you're usually either trying to have fun or you're trying to challenge yourself and learn to walk or learn to stand or learn to ride a bike. Like falling, it doesn't mean failure. Like you can still try again, but it does mean that attempt didn't work. It's some sense of personal loss, you've got to recover from, you've got to bounce back from.
Right.
And that's resilience. Yeah. That's the sense of well-being after the fall, is your ability to rise again.
So then if we go back to that example of falling in love, like you said, this is, a positive thing, but it also is a vulnerable thing. It is a moment where you could get hurt, emotionally hurt, right? If things don't work out well. So there's this milieu of complex emotions, a combination of excitement and also fear that jointly create this belly feeling. And it's the same milieu in a way that you feel on a roller coaster when you're falling down. And so this got me to thinking, as I was thinking about a lot of my patients, many of whom do not like riding roller coasters. And in part, it's because they feel these feelings all the time. And it got me to thinking, in some cases, it's not that there's a problem in the gut itself. In some cases, it's as if a ventriloquist is throwing its voice. There's an emotion center in the brain, like the amygdala, this sort of almond-shaped emotion center that we have in our brain that is sending messages into the gut, projecting this form of gravitational anxiety into the gut, and that's where we feel the fear of falling.
Yeah.
Because we don't want to fall. And so some of my patients with IBS who feel these gut feelings all the time, it's as if they're metaphorically falling down. Like IBS is almost a neurovisceral fear of falling. And when we look at it that way, you start to think, oh, actually, this is a much more complicated mind-body misalignment with the force of gravity itself.
And that's what brought us together, wasn't it? You wrote a paper called Gravity in the Gut. It was a hypothesis of IBS that's based on gravity, that there's some kind of gravitational mismanagement or intolerance within the body that leads to all the various signs and symptoms of a syndrome. It's not a discrete disorder, it's a syndrome of many signs and symptoms. And within that paper, you used the term mental gravity. And I was studying that at the same time. I was working on the idea of mental gravity from my PhD research and thinking about, well, what are the mental extrapolations of mental relations to gravity? And here it popped up in my Google alerts, and we've been emailing each other ever since and working on this idea of biogravitational medicine, trying to bring our two strands of work together about physical and emotional health, all from this basic, feeling of falling, so that's for anxiety. I'm really interested in depression, which is not falling, but being fallen. So you feel like you've completed that descent and you've been hurt or injured by the fall. There's been a loss that's unrecoverable. So it is like a personal failure. It's not an actual personal failure. It's a felt. Just to be clear, you haven't actually failed. It's a felt like myself has descended somehow.
So there's emotional descents and there are physical descents. And why gut feelings is such an interesting starting point for this podcast series is it really sits right at the middle, because I see patients who have very physical problems with their physiology, with their gut in my case, but also we see the emotional consequences of that. And that really teaches us something about the mind and body as a singular, unified system of health.
Yeah.
And often we think about the mind and body as separate and distinct, but they are not. They co-evolved together, right?
Yeah. So we're talking about gut feelings. Let's look at your own gut feeling. You had an intuition one day when a patient came into you with IBS, and there was, just a very subtle sign that they gave you. Tell us that story.
Yeah. So this is a patient I saw who maybe about 25-year-old woman who had been diagnosed with irritable bowel syndrome. And I, shook her hand to say hi, as I always do. And I noticed that her wrist was particularly clicky as I shook her hand. And I wasn't shaking her hand particularly hard. I was just shaking her hand. And I thought for a second, I wonder if that's a clue to what could be happening.
You had a gut feeling.
I had a gut feeling. This is from obviously years of practice and learning and thinking about these things. But I actually had a suspicion there was a form of gravity intolerance leading to her symptoms.
From a clicky wrist. That's quite a leap.
Yeah,
You're going to have to explain
House
that.
MD, kind of thing, for those that have seen that TV series.
Yeah.
So I decided to ask her to take her pinky and bend it back as far as she could, like I'm doing right here. So let's see how far you can do yours. So for those that are listening to this, neither of us is able to bend our pinky back much more than 90 degrees.
Yeah, halfway.
And you might try at home. If you can bend your pinky a whole lot more than that, you may have very mobile joints. And this patient of mine, was able to do it very easily. Her pinky went way back. Then I asked her to take her thumb and to see if she can stretch it all the way back to her forearm. So again, those of you that are listening, neither of us is doing a very good job at this. We are squinting our eyes and in pain because we cannot do that, but she could.
Yeah.
She, without any problem, was able to pull her thumb all the way back. Then I did a few other things. I noticed she had double jointed elbows. She was able to touch the ground easily without bending her knees. She had very, very flexible joints. Unusually flexible. Now, that's not a big problem necessarily, but she also had stomach issues and gut feelings, and she had a lot of anxiety tied into this as well. So I had a suspicion. And it turns out we see this a lot with people with IBS. They have flexible joints. And when the joints are flexible, oftentimes the gut is flexible too. And you can think of it like you have a sack of potatoes in your belly.
Yeah.
Since the day you were born all the way through to the end, we have to carry this sack of potatoes all around wherever we go. And that's the intestinal system and all the stuff in the belly. And it's suspended on a series of suspension cables. And it turns out that for some people, those suspension systems are really stretchy. You can imagine it like a marionette on strings. When you articulate the strings properly, the marionette looks alive. But if those strings, you can imagine, were really stretchy or elastic, then the marionette would droop down to the ground.
Yeah.
It would not look very animated. Well, it turns out that's what was happening with this patient. Her belly, I suspected, was stretching way down and collapsing, and so we ended up getting an x-ray. First lying flat, then we stood her up, and her belly collapsed all the way down on the x-ray, down to the bottom of her pelvis, and it just compressed the whole thing.
Must be so uncomfortable for everything to just be squashed down when it needs to be suspended. That's the whole idea is, it's suspended from an anchor point, not just crushing onto your pelvis. That must be very
absolutely. And
uncomfortable.
it all suddenly started making sense for her because, people told her that she had an anxiety disorder, and then she could fix this with her diet, and all of that may still be true. Diet's important, and we need to think about anxiety. But she had a very physical problem with gravity intolerance.
Yeah.
It turned out she also got very lightheaded when she stood up. Sometimes she would even pass out.
Right.
And I ended up diagnosing her with a condition called Ehlers-Danlos syndrome.
Another syndrome.
Right. EDS it's called. Often is comorbid with irritable bowel syndrome, IBS, and with something called POTS, or postural orthostatic tachycardia syndrome.
Triple syndrome.
She had
right.
all three, and all three are forms, as I think about it, of gravity intolerance. So in her case, what happens, it's like a garden hose. If a garden hose is laid out properly, the water flows through it easily. But if it's not and it's kinked, then the water won't flow through. And what was happening is as gravity pulled her intestines down into her pelvis, it like accordioned and compressed upon itself. It got backed up. The bacteria started to overgrow. It formed gas. This causes stretch on the belly that affects the nerves. The nerves fire off. The brain now is getting overwhelmed with all these signals from the belly. Now the brain's like, what's going on down there? And you get in this vicious brain-gut cycle. Anxiety can occur as a consequence of that. But in her case, she needed to do some physical activities. It didn't cure it, but there's something called hypopressive exercises where you pull in your gut and hold it and then let go, then pull it up again and let go. And you strengthen your abdominal muscles, your core, to help bolster the sack of potatoes, right? And so this is just one example. We could talk about spinal health as well, where the relationship of your physical body to the inner pumps and tubes to the brain is all interrelated and related to this force of gravity that we all feel our whole life.
Yeah. So we're talking about a way of analyzing conditions that are out there as syndromes, but the cause isn't always known. And what we're proposing with biogravitational medicine is maybe at the root cause here, there was flexibility, but the symptoms are caused by the compression or the lack of coherence, you could call it, with gravity. There's something not quite working between the body and the forces of gravity that are impinging upon it. And the spine's a really good, that's a very clear example, isn't it?
Right.
Like you can't, or you struggle to maintain verticality because of the muscles and the bones and the tendons. I mean, that's very clear that that's some sort of gravitational intolerance.
Yeah, I mean, what is low back pain if not gravity intolerance?
Yeah, exactly.
Well, while we're at it, what is ankle swelling if not gravity intolerance? What is dizziness and vertigo or heart failure? These are all forms of misalignment with gravity. And as we'll talk about in this podcast series, it goes beyond the physical. The inner ear is keeping track of your relationship to gravity. And if that system isn't working well, all sorts of things can happen. Anxiety, panic attacks, a feeling like you're not literally in your body, like your own sense of self has been violated because you're no longer aligned with the Earth's pull.
Yeah. So we talk about that in terms of embodied cognition, but I'd go a step further and talk about grounded cognition, that the body is grounded in an external world that has a force of gravity. And that's a well-known concept in psych research is our thoughts, feelings, and behaviors are all determined and constrained by the physical environment. And I've got a way of sort of analogizing sort of back pain and depression, saying they're kind of the same gravity disorder, let's call it, but just in different realms. For back pain, you struggle through the musculoskeletal system to maintain verticality or to elevate yourself. For depression, it's your brain and your nervous system that's struggling to maintain mental verticality. You're struggling to get up and out of bed. You're struggling to maintain an upward sort of perspective on your life and the world. So that's the connection. But the thing that brought us together and led to those kind of insights was this sense of gut feelings at that liminal space between body and brain that's in our core. I mean, we have a center of gravity that we're trying to keep elevated. And where is that? That's in our stomach. That's in our core sense of bodily self. So it's not surprising that it's bodily feelings where our two realms, they're both connected and they overlap. Physical and mental are not separate. They are here together, embodied, and I would say grounded in physical reality.
So the example of back pain is such a good one. And it's a perfect physical example that has mental consequences because chronic pain itself. What is chronic pain? Well, in part, what happens is if you're physically out of alignment with the pull of Earth itself, with gravity, then there's stretch and there's pressure and there's inflammation. And then the body has this way of detecting all of that through something called piezo channels. And what these are doing is detecting these, deflections from uprightness.
G-forces,
The G-forces themselves are triggering these piezo channels, which then take the force of gravity and translate it into bioelectric signals. So now we go from gravity to electromagnetism. It turns out those are the two fundamental forces that we manage all the time. There's only 4 in all of physics, by the way. One of them has to do with stars. That has nothing to do with us. One of them has to do with our body not exploding, basically. So once we've got that under control...
The nuclear forces, we don't need to worry about those.
The nuclear forces, right? Yep. Once we have all that under control, it's about managing the physical force of gravity and electromagnetism. And so what pain is, in part, is a signal that you are out of alignment with gravity.
An electrochemical signal.
It becomes electrochemical. The brain becomes overwhelmed. And now next thing you know, you can get anxious and depressed and all sorts of things can happen. And going back to the back for a second, I was talking about this idea of the suspension systems in the gut, since we're talking about gut feelings. If you don't have a strong back, what happens is everything starts to fall down. The spine is like a chassis. As we started to move from four-legged creatures with our viscera dangling from the spine, almost like ornaments off a Christmas tree, right? To a 90-degree movement upward, where everything started to pull straight down. The spine was this chassis that holds everything up. The rib cage, the diaphragm, and then all of the suspension systems, it's like a crane, are tacked onto the ceiling. So you can imagine, if you don't have a strong back, you don't have a strong core, you can get gut issues. And I see so many people with IBS who have back pain. And often we think, oh, well, back pain is really common. But no, it's actually disproportionately common. And maybe what's happening in some cases is not having a strong enough back, having too much weight in the belly, gain weight. Gravity doesn't change, but our relationship to gravity can change.
For sure.
And then you get a whole breakdown, gut feelings, all sorts of issues evolve. So it speaks to some really simple solutions. It turns out some of the most effective therapies for IBS are exercise and strength training, weight loss. How do these work? Well, they're changing your relationship to gravity.
And it's the same for back pain. The advice isn't, just lie down and avoid any discomfort. You need to exercise and make sure that you're keeping some level of verticality and movement to keep everything maybe not pain-free, but as minimal pain as you can. And it's the same for depression. We know that exercise is as effective as serotonin medications or the medications that we have at both treating and preventing depression. You can't say with 100% certainty who is going to become depressed in their life, but it's a lot of people. It's like one in five is going to experience depression in their lifetime, usually before the age of 25. So there are things that people can do within their life, and we want this podcast to be a very practical exploration. It's deep theory as well. We're going to talk about evolution and consciousness, but really where the rubber hits the road is this practical advice around common conditions, these sort of lifestyle conditions where it's our relationship to gravity that could be the primary driver of health and ill health. So it's a way to both treat and even prevent some of these conditions.
You just mentioned serotonin, and yet another example of how we manage gravity. And we'll talk about this in some future episodes, that serotonin itself is a gravity management substance.
Yeah.
Okay, it actually helps us stand up to gravity. If you didn't have serotonin in your body, you would be a flaccid sack on the ground, unable to get up like a baby.
Which most people probably find quite surprising. We just think of serotonin in the brain as the happy chemical, but most of it's in the body. Most of it's created in the gut, 95%, and it's coursing through your body right now. So I think there's so much to explore in this podcast, not just from the physical and the mental, but it's the connection between the two. What we think of as physical becomes mental, becomes physical, becomes mental. It's this feedback connected cycle.
Well, here's the thing. I mean, physics was here first.
Yeah.
Right? Long before you were here, or I was here, or even the Earth was here,
Yeah,
right?
yeah.
There was physics.
Yeah.
There was gravity, right? Gravity brought the Earth together. And then biology emerged.
Yep.
We are a consequence of physics. We are sense-making machines, in a way, that are evolved to detect these forces, to detect the very force of the planet upon which we were born into.
To stay alive.
To stay alive, stand up, and thrive. And we do that by sensing these data points, almost like a computer. We bring in all the data, and then we compress it into more and more coherent forms until we have this narrative that emerges into our mind that tells us we are on a planet that is affecting us physically and emotionally, and our survival depends on navigating these forces.
Yeah.
And so physics came first, biology came second, psychology emerges in higher order forms like ourselves to now interpret this world, and then sociology emerges from that, and off it goes.
So that's what this podcast is about, the connections between the physics, the the physical, the biological, and the mental. But this idea of gut feelings is where we sort of met, and it just really paints the picture of that connection, that it's the physical and the mental kind of blended into one.
Right. And so we'll be going through lots of examples in this podcast of where the physical and the mental come together in relation to gravity.
Yeah.
And I will say that some people who might be listening to this might think, boy, that seems obvious, right? Of course gravity affects us. I mean, why wouldn't it?
Yeah.
Our relationship to gravity is like a fish to water. I mean, a fish is designed to survive and thrive by moving through water. I may not even know that it's in water. I don't know what it knows.
Yeah.
We are evolved and designed to survive and thrive through the force of gravity, through this field of gravity that we're in right now.
Where there's more gravity because we're in air. We don't have buoyancy.
Yeah, right. That's right. This is obvious, right? Well, what I often say to some of my colleagues who've heard me talk about this is, well, if it's so obvious, then why don't we prescribe hypopressive exercises for IBS more? Why don't we talk to people about their spinal health when they have gut feelings? Why don't we talk to people about thinking about their gut feelings as a signal that they're metaphorically falling? Why don't we use vagus nerve stimulation, something we'll talk about in the future, which I see as a gravity management technique, or tilt tables, or flotation therapy. And the list goes on and on and on of therapies that are already evidence-based, but almost no doctors actually prescribe these things, and they all relate to gravity.
And they all see them as independent interventions in disparate fields. And I think what we're doing here with biogravitational medicine is not introducing anything new other than a systematic way of piecing the pieces of the jigsaw together. We're piecing the puzzle together to say underneath all of these different interventions is the force of gravity that we are sometimes failing to manage. And when we do manage it well, it leads to health and well-being.
It's like the orthopedic surgeon sees the disc problem. The gastroenterologist sees the gut feelings. The ear, nose, and throat doctor sees the inner ear problem, and so on and so forth. The cardiologist sees the pump and tube problem.
Yeah.
But if you take a step back, we're all seeing the same thing.
Yeah.
We're seeing gravity intolerance.
Yeah. And the psychologist often just sees the mental problem. Let's consider the physics, the biology and the physics underneath that.
Well, I can't wait to have more conversations like this with you as we go through some of the details and really start unpacking all of these different ways that our mind and body work together to keep us upright, surviving and thriving on planet Earth.
Can't wait. Thanks, Brennan.
All right.